Say goodbye to anterior thigh muscle pain forever with this simple change to your workout. Making sure you have a leg day in your workout routine is super important, especially if you want to do higher level cardiovascular exercise. You want to make sure that your legs are nice and strong to allow you to do those activities. However, many people like to skip leg day and not work on particularly strengthening their legs to make sure that they can do the activities they want. And it is critically important to make sure that you add that in. However, we want to make sure we add that in the right way. A lot of people, when they're doing leg day, focus on the front of their thighs, which is the quadriceps. That's the muscle that's on the front. And the result of this is that the quadriceps become dominant and the hamstrings, which are the muscles on the back of the thigh, do not work as hard as they should. When the hamstrings aren't working as hard as they should, this can lead to glute atrophy, which can cause a problem, especially with those higher level activities. Now, I will say in general, your quadriceps, the front of your thigh, is supposed to be stronger than the hamstrings or the back of the thigh, but it's important to maintain the proper ratio. And that ratio is a 3-to-2. So basically for every 3 pounds that your quadriceps can use, so that's knee extension. So that's when your knee is straightening. That's knee extension. That's quadriceps. For every 3 pounds that you can extend your knee, you should be able to flex your knee. So flexion's going back, extension, flexion, extension, flexion. We're pretending that's a knee joint. So flexing the knee should be a 2. So for every 3 pounds you can extend your knee or straighten your leg should be a 3, and bending the knee should be a 2. Now, how do you know what your ratio is? If you go to the gym, you can get on a knee extension machine. And in general, I don't recommend machines. I prefer body weight type exercises, but this can be a really good way to get a test of it. So see what your 1 rep max is on knee extension or straightening your leg. And then make sure that you can flex your knee or bend your knee at a 3-to-2 ratio. So let's say you can extend your knee 90 pounds, 1 rep max. You want to be able to bend your knee 60 pounds, 1 rep max. Now, this is just for testing. I'm not saying that you should always do 1 rep max when you're in the gym. Obviously, you need to have a more balanced routine than that, but that's for testing to see where you are in your regards to your strength. And you really want to make sure that you're keeping those hamstrings strong enough to have that good balance. And that way you get the activation of the posterior body when you're doing your higher level activities. What I find in the clinic is that most people become quad dominant or use their anterior body more than their posterior body in an abnormal ratio. So they become more like a 2-to-1 type of ratio. And then this causes increased stress because you're going to use more of your quadriceps and your psoas and your hip flexors. And so if you find that your hip flexors are chronically tight and you feel like, I don't understand why this is happening, you could be quad dominant or anterior body dominant, and you're not using enough of that posterior chain to balance everything out, which leads to the common causes of anterior thigh pain. Often anterior thigh pain can be caused by overtraining, improper form, or muscle imbalances. And so if you work out regularly and you've started to have anterior thigh pain, it can be a muscle strain of either the quadriceps, which is the big muscle on the front of your thigh. So it has 4 heads, hence the name quad, and it attaches into the patella or the kneecap, which then attaches into that lower shin or the tibia. So when this muscle gets strained, you will feel it when you're trying to use it. So again, that leg extension, or even potentially when you're trying to stretch it. Now, obviously, when you're trying to stretch your quads, you should be getting a good quad stretch, right? You should feel like there's something happening. But a stretch pain is different than your pain. Your pain is probably more of a deep, achy, or it could even be a little bit of a sharp, shooty type of pain when you're trying to stretch it. Now, that's not what we're going for. We're going for that comfortable stretch when we're trying to stretch the quadricep. So if you have a sharp, shooty pain or a deep, achy pain that doesn't resolve after stretching, then chances are good that you're actually dealing with a quadricep strain. And this could be due to a muscle imbalance. It can also be caused by having improper form while you're doing your leg day activities. So a lot of people I know really work on that quad definition because that's what you can see in the mirror the most easily. But you want to make sure that you're focusing on your hamstrings and your glutes so that you have that proper balance. Now, the other muscle that can refer pain to the anterior thigh is the psoas, or the hip flexor. So that's like when you're marching in place and you're trying to bring your knee closer to your chest. That's the hip flexor, that's hip flexion. And so that's when you would notice more of the pain. And with people who do leg day regularly, I often see psoas strain when they're doing squats and not returning all the way up and activating their glutes. See, when you activate your glutes, it actually causes a reciprocal inhibition of the psoas. So it causes it to stretch out and relax. When you're staying in that squatted position the whole time and not giving that psoas a chance to relax for a second, it can cause a strain in there. And a lot of people will have that psoas strain that they'll notice when they're trying to do a psoas stretch. So obviously there's a bazillion psoas stretches and lots of people have different ways of doing it, but I do it simply with doing the quadricep stretch. So grabbing that foot behind your leg and then pushing your knee back to try to stretch that anterior hip. The psoas stretch you want to feel more in the anterior hip, whereas the quadricep stretch you're going to feel more in the anterior thigh. And if you feel a reproduction of your pain with that, then it's probably more of the psoas as opposed to the quadricep. The other thing that you would notice is that when you're doing that deep squat, you may get a pinch in there, or you may only have your pain after you do things like leg day. This would indicate that we have a form issue when we're doing our leg day activities. So I'd encourage you to have someone watch you who actually knows what they're looking for. That may be a personal trainer at your gym. It may be your buddy if they know a lot about form when you're doing squats, to make sure that you're doing the exercise with the proper form and not causing an increased strain to the psoas. If you have a psoas strain, I see more issues commonly with lunges in that people cannot do them with proper form because they do not have that full hip flexion mobility, or they have pain when they try to do it, especially if they're trying to do something like a walking lunge. Because when you're doing the walking lunge, not only does one leg need to be extending or performing hip extension, but then that leg's going to need to come forward through hip flexion to be in front of you. So you want to make sure if you're doing any form of lunges, but especially walking lunges, that your body is upright while you're doing that lunge activity to make sure you're getting that nice lengthening through that hip flexor and you're not constantly keeping it in that contracted state. That will also help you to activate your glutes, which you want to be getting balanced with the hip flexor anyway. And now onto squats, which I usually see more with a hamstring strain, that squats are difficult. And a lot of people ask me, what is the proper form for squatting? And this is a deeply controversial issue because some people say your knees should go past your toes. Some people say your knees can't go past your toes. And it can be really hard, especially if you're trying to add weight to that, to get the right form. So to start with, we want to make sure that we're doing our squats unweighted, and we want to make sure that we're maintaining balance. For some people who have very long legs, like I do, your knees may actually go past your toes. And that's okay as long as it's balanced and your glutes are going back to keep you balanced over your feet. Because obviously, if you're trying not to move your knees at all, your bottom's going to go back. And when you add weight, you're going to land on your butt. So that's not going to work at all. However, a lot of people do tend to put increased weight. Their knees go too far past their toes. And this can cause a lot of strain over that patella or that kneecap onto the femur. Now, you would notice this if you had pain after squats right underneath that kneecap, that's causing too much compression on that kneecap. Now that's a very big concern because that's how we can get chondromalacia patella or pain under the kneecap. So you want to be careful that you're not going too far past your toes, but I don't force people who have a normal knee integrity to keep their knees behind their toes because that is a very functional activity. That is something we need to do on a regular basis. Like if you're going to kneel down to the ground to get on the ground or pick something up from the ground, you're going to have to put your knees past your toes. So I don't want to say you can't ever do that, but I will say I do limit that activity as much as as possible in people who do have a diagnosis such as chondromalacia patella, because for those people, they need to limit that motion in order to allow that chondromalacia to heal. So I know that that's not a conclusive answer, because the truth of the matter is there's not one size fits all answer. And I get a lot of comments here on YouTube where people are wanting to know, black and white, which way is it? Well, if you want the black and white of it, if you have healthy, normal knees, it is okay to put your knees past your toes when you're squatting, as long as you're also sticking your bottom out and you're maintaining balance over your feet. However, if you have any knee issues, such as chondromalacia patella or any pain under your kneecap, I encourage you to keep your knees behind your toes for right now, because that causes increased compression of the patella on the femur, which can actually increase your symptoms. Now, as that chondromalacia patella heals or your knee pain decreases, it's okay to gently start moving your knees further forward, but it's not an automatic you go from knees behind toes to knees in front of toes. You need to gradually move into it so the tissue tolerance can increase and you can start to tolerate those motions. Now, I realize that's a bit of a long answer and that requires some discernment on your part of where you really are. But if you've had knee pain before, you probably remember it, and you may even understand exactly what it was that caused it. So just remember, as you're getting back to that activity, move into it gently. Gently increase the range of motion. Take a day off in between. Make sure everything feels okay. You're not getting any increased redness, swelling, irritation, pain, anything like that. And then you can proceed forward. Now, if you have any redness, swelling, pain, or irritation, then you don't want to move forward at this point. You want to take a small step back so that you can train within your available range of motion without causing increased pain. And perhaps the most important thing that I can recommend if you do leg day regularly is to make sure you have a proper warm-up and a proper cool down. Now, for me, when you're doing leg day or any kind of weightlifting, a proper warm-up is cardiovascular, because you want to get that heart pumping, you want to get that blood moving, and you want to get everything warmed up before you do any lifting type activities. So 5 to 10 minutes of cardio, you can choose what you like. In general, I recommend choosing something that you at least kind of enjoy doing. I know people who lift regularly don't necessarily like cardio, but finding an activity that you can tolerate for 5 to 10 minutes that actually gets your heart rate up. Now, if you're going to walk on the treadmill for 5 minutes at a really slow pace and not get your heart rate up, it's not really going to do you any good. You need to get that heart rate elevated, get that cardiovascular exercise for 5 to 10 minutes before you lift. The cool down is the same in that we're going to do that cardiovascular exercise again for 5 to 10 minutes. Want to get that blood pumping, make sure everything gets cleaned out for all those muscles that we just worked really hard at. And then we want to do stretching. Now, a lot of people are surprised that the stretching actually goes at the end, but I don't recommend stretching before you're weightlifting, because you don't want to stretch those muscles out, especially when you're trying to lift something heavy. But you do want to make sure that they're stretched out before you leave the gym. Before you cool down, you want to make sure you're stretching the muscles that you just performed some lifting activities with, to make sure that you don't lose length while you're gaining strength. All right, so there it is. The importance of adding leg day into your workout, but making sure you do it in a good way. Make sure you have a proper warm-up, which is 5 to 10 minutes of cardio. Make sure you have proper form while you're doing your leg day. Make sure that you have a proper cool down, which is 5 to 10 minutes of cardio, followed by stretching before you leave the gym. If you leave the gym, get in the car and drive home, chances are you've cooled down during that time and your stretching is not going to be as effective. And make sure that you do test your 1 rep max. So that's knee extension, that's straightening your leg, should be a 3, and bending your knee or knee flexion should be a 2. Now, if you are suffering with knee pain, I'm going to drop a link below where you can download my free knee pain ebook to get more information about how to deal with your knee pain.